Well, good afternoon, everybody. Welcome to Cancer Support Community Central Ohio's Lunch and Learn. Today we are doing a presentation from our Frankly Speaking About Cancer, which is our headquarters award-winning education series. And this presentation will be on why can't I stay positive? You are more than welcome to ask questions as we go through. There will be time at the end for question and answers, but you are welcome to ask questions as they come up. So we'll go ahead and get started. Um, there we go. So Cancer Support Community's mission is that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. So that is our mission for all of Cancer Support Community and their network partners. So this program was developed by our headquarters, as I mentioned, Frankly Speaking About Cancer, and then it is reviewed by outside psychosocial experts just to review it to give some fresh eyes, but we do have final control over the content of our programs. I think everybody knows that I am employed by Cancer Support Community. I am the program manager here at Cancer Support Community Central Ohio and have been for the past 6 years. So the overview of today's session is we're going to just kind of set the stage, and then we're going to talk about depression and cancer, grief, resilience, and then we'll wrap up with some resources that is available through Cancer Support Community. So when we're looking at setting the stage, the universal challenges of living with cancer might include some of these things. A lot of times I hear from participants that they feel that they're in this journey alone. And sometimes, unfortunately, their circle of friends who they had prior to the diagnosis has backed away from them, which is really sad. And sometimes that's because of the person without a cancer diagnosis doesn't know what to say. They don't want to be a burden, but that's when they really need your friends more closely. But sometimes people lose friendships in their cancer journey. Unfortunately, cancer is a very expensive disease, so that financial burden is there. Sometimes, depending on your diagnosis, it could be just that loss of hope. And definitely the loss of control. None of us have asked to receive a cancer diagnosis, so that was out of our control immediately from the get-go. And then just that living with uncertainty. What does the future hold? We just don't know. So the top 10 concerns across the registry participants. So this comes from our Cancer Experience Registry, which is a longitudinal study through Cancer Support Communities Research and Training Institute, which is located in Philadelphia. And when they pulled this report, it was showing that the number one concern really in 1 and 2 were the same 56%. You'll see that not only eating and nutrition, but there's a lot of concern of cancer recurring, either progressing or coming back. And then just slightly followed by worrying about the future and what lies ahead. And then the top 5 are rounded up by the exercising and being physically active, and then feeling too tired to do the things you need or want to do, which unfortunately is a very common side effect or even a complication from the treatment. So that's the top range from this research study that follows people from diagnosis all the way through survivorship. So they do have they have several different registries. There's one specifically for cancer survivors, and then there's one for caregivers. So focusing here on the patients and the survivors, 49% said that they were at risk for significant levels of anxiety and 38 for depression. And again, this comes from our Cancer Experience Registry, that the last report that was polled. And then for the caregivers, as I mentioned, 49% really show substantially worse anxiety than the national average. And then they are substantially worse in fatigue at 34%. And then 39% of our caregivers said their own health was somewhat worse or much worse than before they began their caregiver role because they're so focused on their loved ones and the person that they're being a caregiver for that sometimes their own health can slide back. And so, living with uncertainty, there's a lot of things that lead into that. 53% of respondents indicated that they are worried about the future and what lies ahead. Again, this comes from the Cancer Experience Registry that, having plans put on hold or fearing that the treatment will stop working and no longer being effective or that it won't even work at all. So really what depletes our resources? As you can see that, the distress and the depression and the grief, and, limited support can really deplete the resources that are already kind of small to start with. And so there's going to be some resources, and things that we can do to help manage distress, treat depression, recognize grief, and then offer that social support. And so distress, which is a mix of anxiety and depressive symptoms, may cause sleepiness, lack of appetite, trouble concentrating, and difficulty carrying on regular activities. Although some distress is normal, about a third of cancer patients experience significant distress. Only about 5% of those with cancer obtain psychological help. While distress doesn't affect the cancer itself, it does affect how patients cope with their cancer and their ability to follow treatment recommendations. So some predictable stress points are the diagnosis, treatment decision making, that scan or scanxiety, and cancer progression. Anxiety is a term coined for that feelings of anxiousness and anxiety that you have when you have a scan or lab work coming up because you've already gone through the trauma of receiving a cancer diagnosis and then that fear of, what is this next test going to show me? So that anxiety is a real thing, and we want to recognize that. So when you're looking at these questions, you're thinking about today, how concerned are you about? And if you've ever done one of our distress screener tools called Cancer Support Source, these questions come from that source. Again, they created through a research and training institute. And you're looking at this on a Likert scale from not at all to number 5 being very seriously. And so, looking at these questions, um, think about the areas that you are moderately or seriously concerning to you. And then if those are of that issue, then think about who can you talk to about that? Do you have a nurse navigator or an oncology social worker or your medical team? And if not, we have social workers here at Cancer Support Community Center Ohio that would be very happy to meet with you and talk about these things. Um, this is really just a lot of the things that through research shows that our cancer survivors could possibly be experiencing. And so they use this tool to help identify those things so we can come up with a treatment plan or a personal care plan to help utilize the resources that Cancer Support Community Central Ohio has to offer that you can make the most of all of our programming. And so this is that cancer support source questionnaire that they use. So, talking to your healthcare team about your concerns, it's really important to just talk to your provider about those top concerns that you have from the previous page or other things that have come up that weren't even identified by that distress screener tool. Never be afraid to ask for support and resources. If you don't have a navigator at your healthcare facility, ask for one or ask for an oncology social worker. They are just a wealth of resources and support for you. So when you're thinking about the burden of positive thinking, you're like, wait a minute, everybody says be positive, be positive. Um, but it really can be a burden. There's a lot of myths and worries that a lot of patients and caregivers have that negative thinking can cause a recurrence. If I'm negative, then that's going to make the cancer even worse, or it could bring the cancer back. But there's really no evidence that high level of optimism prior to treatment enhances survival in patients. Encouraging patients to be positive only may add the burden of having cancer while providing little benefit, at least in patients with a cancer diagnosis. And this came from the ACS journals. And I apologize, I didn't do my research of what the ACS, I think it's the American Cancer Society's journals. So there's research that shows that adding the burden of positive thinking might not always be all that beneficial. So again, looking at that burden of positive thinking, that tyranny of positive thinking is the inability to acknowledge that cancer is difficult and a frightening experience. Um, Insistent that you put on a happy face. I mean, I remember with my dad when he would have the side effects from his chemo, he was not having a happy face. He was nausea and all of the side effects that was coming with that. So that, asking my dad to put on a happy face just was not realistic or even understanding of what he was going through. Feeling guilty because you're unable to maintain a positive attitude, or even the belief that a wide range of emotions is unacceptable. I mean, we're humans and we have emotions that come, and some of them are very positive and some of them are very negative, and we need to honor all of those emotions. And of course, this is coming from the human side of cancer, Living with Hope, Coping and Uncertainty by Dr. Holland. So, thinking about your experience with cancer, have you ever felt pressure to think happy or to put on a smile on your face or to find a silver lining in any of this? And just think about that and then, maybe how you felt when somebody was giving you those instructions. So, moving on to depression and cancer. So what is depression? So the DSM-5 diagnostic criteria outlines the following to make a diagnosis of depression. The individual must be experiencing five or more symptoms during the same 2-week period, and at least one of the symptoms should either be a depressed mode or a loss of interest and pleasure. Depressed mood most of the day, nearly every day. Marked Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight loss when not dieting or weight gain, or decrease or increase in appetite nearly every day. Slowing down of thought and reduction of physical movement, kind of really seen by other people, not merely subjective feelings of restlessness or being slowed down. Fatigue or loss of energy nearly every day. Feelings of unworthiness or excessive or inappropriate guilt nearly every day. Diminished ability to think or concentrate or indecisiveness nearly every day. Recurrent thoughts of death, recurrent suicidal ideology without a specific plan, or suicide attempt or specific plan for committing suicide. To receive a diagnosis of depression, these symptoms must cause the individual's clinically significant distress or impairment in social, occupational, or other important areas of functioning. The symptoms must also not be a result of substance abuse or other medical conditions. So this is just the language. The DSM is a document that is used by psychosocial mental health professionals in diagnosing and then coming up with treatment plans. So that's from the DSM-5. So what does depression feel like? You're looking at mood-related symptoms, sad and hopelessness, being numb, maybe being irritable or feeling worthless or just really being down. So some physical symptoms of depression, you might lose your appetite, as we mentioned earlier. Your sleep can definitely really be affected. You might have intimacy problems and just that fatigue of just not having energy whatsoever. That's insomnia, not being able to fall asleep and stay asleep, where hypersomnia is feeling very sleepy most of the day. And then those sexual problems, such as having a lower sex drive. And then some behavioral symptoms of depression. That loss, that loss of interest in activities is always really a key question that the providers will ask. You might have emotional crying or just really feeling of loss of that motivation of being able to want to do anything or withdrawing from people. And then some cognitive symptoms of depression. A problem with focusing could be depression, but it also could be chemo brain. So you got to be careful with taking just one specific um, thing on this list. It should be a couple things, such as having negative thoughts or difficulty making decisions or even memory issues. Because if you've ever experienced chemo brain, it can be very frustrating. But this isn't necessarily part of a depression. So knowing yourself and how you're feeling if you're having these other previous symptoms that we've identified. And then in extreme situations, you might even be having some suicidal thoughts or that life is just not worth living or wanting to harm yourself. And if those occur, please, please find someone to speak to. So what do we know? It's common. Approximately 1/3 of cancer patients report a mood disorder at some point after diagnosis, with the first year after diagnosis posing the greatest risk. And this is from a research study. And between 10 to 20% of cancer patients continue to report depression and anxiety after the initial stress of the diagnosis or recurrence. Further, more than half of cancer patients and survivors report fatigue as an ongoing issue, and a large number of survivors continue to also struggle with pain and isolation. So these are all research study information. So you're looking at those depression, those reports of those research studies, and then they also indicate that depression equally affects men and women. And we're showing that, again, this is from our Cancer Experience Registry, that depression can impact a cancer patient's life in a variety of ways. The quality of life measures may lead to decrease in adherence to cancer treatment, which may lead to longer hospital stays. So really, 38% reporting substantially worse anxiety than the national average, and 26 reporting substantially worse depression, more so than the national average. So really make sure that if these are issues that are affecting you, please do talk to your healthcare team about your concerns. We've mentioned before your doctor, your nurse navigator, your oncology social worker. If you're in a support group, your support group facilitator. Just really, you don't have to go this road alone. Definitely let your healthcare team know about your concerns and any issues that you're experiencing. So what else do we know? We know that it's treatable. In addition, patients may benefit from a range of approaches, such as relaxation strategies, psychoeducation, cognitive behavioral therapy, problem-solving therapy, and acceptance and commitment therapy. The cognitive behavior therapy identifies and equips patients with the skills to overcome maladaptive thought patterns and encourages emotional readjustment. Both psychoeducation and cognitive behavioral therapy has been demonstrated to be effective in improving depressive symptoms and quality of life. The acceptance and commitment therapy teaches patients how to tolerate difficult thoughts without being overwhelmed or dominated by them and develops psychosocial flexibility. It has been demonstrated to be equivalent to cognitive behavioral therapy in terms of its effect on mood and quality of life. And the relaxation and imagery for anxiety and depression and control in community patients with advanced cancer is where we received this information. That is the research study that this came from. So treating a combination of therapy and meds are often most effective. Medications may not be available due to other medications and cancer treatments, so it's very normal to seek treatment, including medications for mental health during cancer, caregiving, and other periods of distress. You should talk to your healthcare team about how you're feeling. So there's different types of antidepressant medications are available, and your doctor will select the most appropriate antidepressant based on your needs, potential side effects, other medications you take, and your medical history. Tell your doctor about all of the medications and supplements you take because there might be some interference. Some people have improvement 2 weeks after starting an antidepressant medication, but it often takes up to 6 to 8 weeks for the medication to have full effect. And it's particularly effective in improving mood and physical symptoms associated with major depressive disorder. Adding psychosocial treatment to medication may be helpful for managing negative thoughts, a low self-esteem, and finding better coping strategies. So moving into grief and cancer. Mary Oliver says, we shake with joy, we shake with grief. What time we have those two house as they are in the same body. So one form of grief is living loss. This represents how we may experience chronic or ongoing sorrow in the space between what is and what should have been. This may capture how you thought you would be spending your time at this point in your life compared to how in reality you're having to spend your time dealing with cancer or its after effects. I know with mom and dad, they were planning to, once he retired, do some things, travel, join the local VFW. And unfortunately, he received his cancer diagnosis before he could retire, so that their future plans had been completely changed. So the where we wanted to be and where we were at that point in their life had been completely different. Another form of grief can be what can be described as ambiguous loss. This type of grief involves a sense of loss that may be unclear and defiles resolution. We may feel a sense of loss, but not being able to fully know exactly what we have lost, making it even more complicated to process. That's why with that ambiguous. Cancer may also result in what has been termed a loss of the assumptive world. We typically develop a sense of the world and develop assumptions or beliefs that help us feel in control, give us a sense of security and stability, and help us make sense of our experience. This might be that we work hard enough and are a good enough person, then we will have a good life. These sorts of beliefs can form our core beliefs about ourselves and about what we expect to happen in our life. But in the face of illness or struggle, these beliefs can be challenged, which can feel disorienting. We may feel stuck trying to make sense of why we have to go through something so difficult that doesn't fit with how we thought the world should work. Another type of grief is termed disfranchised grief, when grief is invalidated, minimalized, or not publicly acknowledged. We may feel a sense of loss that is not recognized by people around us, such as when people might say someone should be happy to be alive rather than expressing understanding why someone might be sad that their cancer treatment has pushed them into menopause and prevented them from having more children. This type of invalidation over what is considered an appropriate or inappropriate sense of loss can come from significant others, friends, healthcare professionals, and may even be internalized when we talk to ourselves out of feeling grief. Complicated grief, losing a loved one, is one of the most distressing and unfortunately common experiences people face. Most people experiencing normal grief and bereavement have a period of sorrow, numbness, and even guilt and anger. Gradually, these feelings ease, and it is possible to accept loss and move forward. For some people, feeling of loss are debilitating and don't improve even after time passes. This is known as complicated grief, sometimes called persistent complex bereavement disorder. In complicated grief, painful emotions are so long-lasting and severe that you have trouble recovering from the loss and resuming your own life. Complicated grief is like being in an ongoing, heightened state of mourning that keeps you from healing. And anticipatory grief. If you have a loved one with an advanced cancer, you may already be preparing yourself for their end of life. As your loved one's illness progresses, you may even feel like you've already lost them as a person. If this sounds familiar to you, you may be experiencing anticipatory grief. While it shares some commonalities with conventional grief, some symptoms are unique to anticipatory grief. Anticipatory grief can often be mixed in with hope that your loved one will live longer or survive their illness, while conventional grief signals that a loss has already occurred. The National Cancer Institute defines the most common symptoms of anticipatory grief as depression, heightened concern for the ill person, rehearsal of the loved one's end of life, attempts to adjust to the consequences of a loved one's end of life, anxiety and worry, increased irritability, mourning changes in the loved one's personality or physical experiences. So activating hope. Please note that hope is not wishful thinking. Hope is adjusted and adapted over time. And so the statement here, hope dies last. And so that includes that self-compassion, finding meaning in life, acknowledging but not avoiding, reducing isolation, and cultivating resilience. So think about what we've just discussed in regards to grieving, and think what are you grieving? And how can you honor and acknowledge your grief? One of the healthy things is to actually acknowledge that and not try to avoid or ignore or say, oh, I'm not, being in denial. That's really not healthy at all. So, just acknowledge these are the feelings that I'm feeling and honoring those. And then, finding those ways to help overcome those feelings. So we're moving into our last section of resiliency and cancer. There are many ways to define resilience, ranging from bouncing back from adversity to positive adaptation or growth through a life disruption. And this came from a research study by Luther, Cricket, and Becker. Most agree that resilience is a process that begins after a significant life difficulty involves ongoing recalibration. DeShields et al. Propose a model of resilience that recognizes the ways in which individuals experience the world before cancer affects their response and ability to cope with cancer. In this model, mindfulness is the foundation of resilience because mindfulness allows individuals to remain present with whatever challenges life presents. And so you can see this quote here by Seeler back from 2019. Just resilience is a process that happens over time. So these came from Front Psychiatry and Oncology Nursing Forum. And so some research that shows that resilience is an active process of facing adversary related to a cancer experience. That ability to restore emotional and physical functioning when confronted with stressful life events. It's not something that people either have or do not have. And it involves behaviors, thoughts, and actions that can be learned and developed over time. So cultivating resiliency through mindfulness. Mindfulness can be helpful for a wide range of physical and psychological outcomes, including anxiety, depression, stress, fear of cancer recurrence, fatigue, chronic pain, difficulty sleeping, and immune functioning. It has also been related to increase in perception of social support, optimism, and overall quality of life. And so that is a skill that can be learned. And it's just being present in the moment, just not making any judgment, just being present is what mindfulness really is. So we're going to do just a very quick mindful procedure here. And please find a position in which your body is comfortable. Close your eyes gently or look down at the floor, doing whatever you feel you need to feel, doing whatever you feel you need to do to feel comfortable. Now take a few easy, slow breaths. And with each, trying to simply release any tension you notice in your body. Simply begin to notice your breath, feeling your stomach rise as you breathe in and lower as you breathe out. Notice the rhythm of your breath. It is only natural that your mind may begin to wander. As it does, gently remind yourself to return your focus on your breath. Stay in this moment, gently breathing, connecting with your breath. Allow yourself to feel whatever you're feeling and to be present with your current experience. And when you're ready, you may open your eyes. And so that's a very gentle mindfulness practice that took us probably maybe 20 seconds or so. So it doesn't have to be a long, involved process when you're practicing mindfulness. It's just really focusing on the here and the now, being present within yourself. Um, and I know that we have a mindfulness hour twice a month. Kevin Kraska leads that program. He is an expert in mindfulness practice, and that's the first and third Wednesday of the month from 9:30 to 10:30. And that class is hybrid, so you can either attend in person or on Zoom, whichever is best for your schedule. So, three daily activities that you do that you can take. Looking for the good is not positive thinking. It allows for both and thinking, it allows for both and thinking and feeling. It's about gratitude. You know, think about two or three good things every night before bed to promote resilience. And so when you're looking for that good, find that one of the things that I found beneficial is to have, that like a gratitude journal, that identifies two or three things, or sometimes depending on the day, it's just one thing that I was grateful for, or it was a good thing that happened. And by journaling it before going to bed, I'm ending the night on a very positive note. Um, and so that's one of the daily activities you can take, doing up to 10 minutes of mindfulness practice, and then offering random acts of kindness. So, some key takeaways: both distress and depression are treatable. Resilience can be learned and strengthened. Positive thinking isn't the goal. Acknowledging grief matters. And you definitely do not have to do this alone. So some resources from cancer support community that will help not doing this journey alone. We have a helpline that is staffed by licensed professional counselors and navigators to assist you. This is staffed through our headquarters. And it's an Eastern Standard Time phone number, and that's why the hours are a little later. It doesn't open until 11 o'clock. So our West Coast participants aren't getting up at 5 o'clock in the morning trying to find help. Because there's some licensed professional counselors on the phone, they can do short-term counseling with you. They can also find local resources. And then the navigators, there's four specific navigators that they have on our helpline. There's one for clinical trials. There's one for genetics. There's one for finances. And the fourth one is pediatric oncology. A couple of other programs we have, the Cancer Experience Registry, that longitudinal study that I mentioned earlier. It's the focus of this registry is on collecting, analyzing, and sharing information about the experience and needs of cancer patients and their families throughout the cancer journey. We have another program called Open to Options. It's a research-proven program that can help you prepare a list of questions to share with your doctor. Our specialists can help you create a written list of specific questions about your concerns for your doctor. Because sometimes I've had participants who say, my oncologist is telling me one thing, my surgeon is telling me something else, and then the nurse navigators, I'm getting all of this information from all these people. What is the best treatment option for me? And we don't tell you what that is, but we help you to identify a list of questions, really focusing on your goals and what you want the outcomes to be. And then you would take that list of questions to your medical team, and that'll help then guide and direct to the best treatment options for you. And then, frankly speaking, about cancer, as I mentioned at the very beginning, it is Cancer Support Community's landmark education series that provides trusted information on a variety of topics important to people affected by cancer. Information is available through print and digital publications, online and in-person programs. So if you go to our headquarters website, which is cancersupportcommunity.org, one of the tabs is um, education. And when there's a drop down box, and you'll see that one of the options is going to, frankly speaking, about cancer. And our headquarters has over 150 publications on there on a variety of topics. And as I mentioned, some of those are in print, and they will mail that booklet to you at no cost, or it's a digital version that you can download and either print off or save to your computer. So I think you're familiar with Cancer Support Community Central Ohio, where we are at 1200 Old Henderson Road. Our website is cancersupportohio.org, and our main phone number is 614-884-HOPE, which is 614-884-4673. And that brings us to questions. What questions does anybody have? Well, I appreciate, oh, I'm sorry, Teresa. Yeah.
Sorry, I couldn't find my unmute button wasn't working again. How can I get in touch with Open to Options?
I'm actually both myself and my supervisor are trained in doing that program. So we could schedule a one-on-one session with you, or the navigators on the helpline also can do an open to option session with you. So we can do an in-person one here, or on Zoom, or you can call the helpline. So there's a couple of different ways to connect with that service.
Okay, great. Good to know. Thank you.
You're welcome. Well, I thank you all for joining us today. If you do have any questions, please don't hesitate to reach out. I'm being here at Cancer Support Community Central Ohio. I'm always just a phone call or an email away. I will be uploading this to our YouTube channel. So when you go to YouTube and you have to type in Cancer Support Community Central Ohio to get our videos. If you do just Cancer Support Community, you'll find a wealth of videos from our headquarters, but ours, you have to type in the whole title. So thanks for joining us today. I hope everybody has a wonderful rest of their Wednesday.
Bye, Darlene. Thank you.
Bye, Teresa. Thanks.